Hey, I'm Justin Wecker with PFTA Austin, and today's joint action table is going to be hip joint action. The first joint action is going to be hip extension, which we should all know. Squats. Okay. Now with squats, our primary mover should be gluteus maximus. The reason I say should be is because a lot of people do not use the glutes in the squat essentially to come out of the hole, so then they target the quad. All right. The plane of motion with hip extension is sagittal plane. All right. The exercise is sit-ups, and sit-ups actually target psoas major. A lot of times we mistakenly think that it targets the abdomen wall, but it's more so the psoas major. That plane of motion is also the sagittal plane. So our next joint action is going to be hip abduction. All right. The exercise is actually just called hip abduction. All right. Or you can call it abduction. All right. And we are talking about the standing hip abduction in this one. Just kicking that heel out, right? But that primary mover is the gluteus medius. All right? And in this exercise, specifically, it's the frontal plane. I say that because there are hip abduction machines where you're just seated and rotating out. In that situation, because the hip is rotating, it would be the transverse plane. All right. Our next joint action is hip adduction. The exercise is just simple hip adduction. You can also call it cable adduction. All it is a band or a cable pulling in, and you're essentially squeezing the thighs together. If you were to just stand here and just squeeze your thighs together, that is also a form of adduction. All right. We are working the adductors, adductor magnus. Basically, it's a stream of muscles that run along with the hamstring. Okay. And we tend to call them the adductor group. In the standing adduction, where you have a cable or a band hooked to your thigh or ankle, it is the frontal plane. And the same idea as with abduction, if you're doing a machine where you're seated and you're pulling in, it's the transverse plane. All right. So our next joint action is hip external rotation. Now with hip external rotation, it's very specific in rotating the whole leg, almost like your heel is locked on the ground and you're rotating from the hip to hip into the glute. All right. So we tend to use bands, water, or even sand. And that's just an external rotation from the hip. That primary mover is the gluteus maximus. And because we're rotating at the hip, it is part of the transverse plane. All right. The next joint action is hip internal rotation, which is just the opposite. And you're also using bands, water, or sand. And because it's rotating the opposite way, we're going to hit the gluteus medius or gluteus minimus. Okay? And that is also part of the transverse plane because we're rotating. All right, so that's it for joint actions today. If you want to see these in action, check out our squat video on YouTube. Or if you're interested in learning more about our personal training programs, check us out on our website at pftaustin.com.